Laser vision correction has helped thousands of people see without glasses or contacts, but how do you know if it's right for you? Dr. Gold is a board-certified and award-winning ophthalmologist and the owner of Liberty Vision. And today he brought along his patient, Ebony Langston, a mental health counseling student and supervisor of visitations for All Point Care. Welcome back, Dr. Gold. Ebony, thank you for being here.
Thanks for having us.
Dr. Gold, you've performed vision correction surgery on more than 11,000 people, some of them even your family members.
Exactly.
What separates your practice?
I think what makes us unique is that the first person that the patient meets when they come in to be evaluated to determine whether they're a candidate or not is myself. So I do the screening, the preoperative work, the surgery, and all the postoperative care. I have an assistant who does one of the scans to create custom vision correction. And frankly, I have her do it because she's better at it than me. And in other practices, it's common in some practices that I'm aware of, the first stop the patient makes is the business office to make sure they can pay for it. Mm-hmm. So there's sort of like a factory approach in lots of other practices.
Sure. Now, Ebony, I want to ask you, what made you turn to Dr. Gold?
Actually, a recommendation from my professor.
Mm-hmm.
She had actually went to Liberty Vision, and she loved her results, so I trusted her. And
talk to me about your vision before. You had the surgery about 3 months ago, right?
yes.
So what was it like for you prior to visiting Dr. Gold?
Prior, I couldn't see anything in front of me.
You had contacts or glasses?
I had contact lenses and glasses.
You did.
But waking up in the morning, my vision was completely blurry.
Mm-hmm.
I couldn't see anything.
All right. And I'm sure you always had to keep the glasses handy, right?
Yes.
All right. And did you think about doing this and finally went to Dr. Gold? Is this something that you always wanted to do?
I always wanted to do it, but I was afraid.
Sure.
Naturally, because you don't know what could happen.
Mm-hmm.
But after talking with my professor, she convinced me, and I was sold.
And you're in good hands with Dr. Gold, right?
Yes.
So how would you say the laser surgery changed your life?
Well, now it's just more convenient. It's more comfortable. I don't have to fight to put contact lenses in anymore. So.
Very good. I have a sneeze coming. Excuse me. Dr. Gold, let's talk about the difference between epi-LASIK and LASIK.
I think we have a graphic that shows it very well.
Absolutely.
In LASIK, the cornea is cut open. In epi-LASIK, the epi-LASIK is the picture on the left, and you see there's no evidence of cutting. The picture on the right is LASIK, in which a flap is cut in the cornea and folded back in order for the laser to work. The next graphic shows how we get the surface layer off just in order to be able to expose the second layer down. So the laser correction happens in the second layer instead of deep in the third, and there's no possibility following epi-LASIK of the cornea being damaged again by a blow to the eye. Mm-hmm. And that's the case in LASIK for the rest of the patient's life if they get hit in the eye just wrong. And I can show that better with this model that I have right here. If the patient gets hit in the eye later on, having had LASIK, this flap can come loose, mm-hmm. and the patient has 1 hour in which to find somebody to fix it, or they're probably going to need a corneal transplant. So epi-LASIK is immensely safer.
Mm-hmm. Now, who would you say is a good candidate for epi-LASIK?
Just about anybody beyond the age of 18 who has finished growing, and we determine that by knowing what their last 3 prescriptions were the last 3 years, who does not want to use contact lenses or glasses anymore, could be a good candidate. We do some scans at the time of that first visit in order to make sure that there's no evidence of cornea being too thin or the cornea being partially degenerated. Those patients would not be a candidate. And I see those people a few times a year, mm-hmm. where I have to turn them down for laser vision correction.
Now, Ebony, talk to me about the day of. How was the procedure? Was there pain? What did you go through?
I just had to come in and bring in my medicines. I talked to the receptionist there. She was very nice, and just basic prep.
Pretty simple though, right?
Yes, very
did you
simple.
feel anything?
No, I really didn't feel much of anything. It was very quick.
Well, that's encouraging, right?
Yes.
Pretty easy, doctor. We know that you're the only Connecticut ophthalmologist to represent the Better Vision Network. Tell us about that.
Well, that's a real honor that was bestowed on me last year. There's an organization called the Better Vision Network whose spokesperson is Lindsey Vonn, who everybody's heard about lately.
Sure.
Unfortunately, she wasn't able to ski this year in the Olympics. But they are an organization that promotes safe laser vision correction, and they've selected doctors from all the different states, in some states more than one doctor, and I was lucky enough to be selected for Connecticut.
You get a lot of honors here, Doctor. Tell us about
We
the
do.
last one here.
The Trademark Who's Who organization has just bestowed on me my latest award as a top doctor in ophthalmology. And
Congratulations, that's great.
I love getting awards.
Well, why wouldn't you? Talk to me about the special offer for Connecticut Style viewers.
Anybody who calls in and mentions this program receives a $200 per eye discount on laser vision correction, and we've extended that offer to all first responders and active and retired military to honor their service as well.
Very good. Well, let's put the information up on the screen. If you want to find Dr. Gold and learn a little bit more about EpiLASIK, you can contact Liberty Vision in Hamden or visit libertyvision.net, and you could also find them on Facebook. You're pretty active on Facebook, Doc. A lot of fun pictures.
Well, one of the things that I just tried to do, and I'm not sure I was successful over the weekend, is I tried to get a message to Bob Costas in Sochi, Russia. He's got an obvious eye infection that isn't responding to whatever they're doing for him. And I'm concerned, and I don't know how to directly contact him, so I went on Twitter and Facebook hoping somebody would get the message to him that he needs to be seen by an ophthalmologist, not just the team doctor in Sochi.
Got it. Well, I hope you get a response,
I
Doc.
hope he does what he should do.
All right. Well, we'll stay tuned for that. And Ebony, thank you so much for sharing your story with us.
Thank you.